Hi there. Today I would like to talk a little bit on how can we know if a patient has a better chance than others of actually getting better using stem cells. So first of all, we need a couple of data pointers to get started. So we're going to show what we like to call the healing triad, as you can see over here. So as the name suggests, it has three different areas that we need to be on point to get a successful treatment using stem cells. So we're gonna go one by one. Point number one, the right kind of stem cell. So we need a right or the adequate balanced mix of fetal and embryonic stem cells. Depending on the issue at hand, this can be personalized. Point number two, the right kind of stimulation. This can be addressed with growth factors, such as precursors or PRP, or applying the tissue that produces that particular growth factor, or taking certain medications that might limit certain growth factors, for example, estrogens or blood thinning medications, or even over sun exposure. All of this has a different effect in the stimulation cells. Point number three, the right regenerative capacity of our patient. The main idea is to know if our patient is more likely of being stimulated for cellular recovery, healing, or cellular reproduction. So, how can we get a general idea of this? Number one, the age of our patient. The lesser the age, the better chance of being able to heal the different tissues, since at a younger age we have a much higher cellular reproduction. Point number two, the amount of total damage. This can be noted very easily, so you can have an idea how many tissues are involved in the damage and the illness, how many organs, how many systems. So it would be basically the same. The lesser number of tissues, organs, or systems that are involved in the illness, a better chance of recovery or cellular regeneration. Simple, right? Point number three, the start time of the damage. If the injury is less than 12 months old of its initial appearance, there's a better chance of being regenerated. If the injury appeared more than a year or two, we start losing that capacity of the regeneration as time goes on. The main idea is just to know if it's even worth trying out this kind of treatments or not wasting any of your time, of your money. So we can check, or we have to check, if our patient is younger or older, what kind of patient is he, how amount of damage is there, and how long he has been troubled with this kind of illness. So we have a couple of examples just to clarify a little bit this. Patient A, you have an 89-year-old man with mixed dementia and 10 years of diagnosis. So it's an older patient and more than 10 years with the diagnosis. Patient B, 54-year-old woman with type 2 diabetes. She's controlled with no complications and has a 10-month diagnosis. So as we can clearly see, patient B has a much better chance of cellular regeneration and getting a better result with this kind of treatments. So that'll be the general picture. Hopefully this will be insightful and will be helpful to you all. So thank you for watching. Hopefully we'll see you soon.